It really meant a lot to me to be able to get myself involved and to help potentially future generations of type 1 diabetics. So the minute I heard about this and I felt comfortable with it, it made sense to me to get involved and see if there's a way to possibly make our daily lives and control just easier across the board. I think I gave my name to my doctor and basically got myself on a list for potential patients of future studies. Effectively, I got an email in my inbox and had all the details of what the study was and what it entailed. I read through it, felt comfortable with it, and I got on a phone call with them, and then the rest is basically history. I ended up getting involved in the study, and I keep getting asked about future studies as well, so that's how I got involved. One of the items was managing 2 insulin pumps at the same time. That was quite the adventure and quite the experience, and a lot of literally weight on my, we'll say, waist instead of shoulders. When I went into the interventions, that was something that was, I think, a little more controlled environment, and I just had to keep myself entertained the whole time. So that was my experience throughout it. The support I received from the trials team was really good. Prior to doing and going in person, doing my interventions, we would be connecting pretty much once a week, and we were reviewing numbers and make sure that I was actually set for a proper baseline. That way, when I went into the inpatient step of the trial, I was then already had a baseline set up, and then they can just make little minor adjustments as they needed to along the way. But we were speaking. At the beginning, it was actually more than once a week. It was almost every night or two. We were speaking with the nurses and the doctor, the lead doctor on it. They were very supportive throughout, and they let me know exactly what to expect. There wasn't at any time where I felt I was uncomfortable or anything along those lines. The trial impacted my T1D management very, very positively. I was actually really impressed to see the results of it. I had much more stable control post mealtime. It seemed to me that it was making an impact in control in a positive way in my daily life. And it was evident on the results that they showed that that was the case. So very, very, very impressed with that. I would say that it's something that I would recommend if you're comfortable with it and you know any risks are involved in the study, that you do get involved. Again, this is a massive, massive piece for the future generation. Get yourself on the list for clinical trials. There's different avenues you can go to get your name out there. And then from there, you can always do your research before, understand what's involved in the study. My recommendation is to get involved for sure.